guess I'll just jump right into it so that we don't run over. So again, my name is Alia Alhumaid. I'm an internist and a geriatrician, and I'm the newest member to have joined Tualatin Internal Medicine. And it's our great pleasure to be hosting Health and Wellness Wednesday this month. And the topic of today's talk is mental health during COVID-19. Okay, hopefully this will work. There we go. So for those of you who do not know, May is Mental Health Awareness Month. So I thought, what better to talk about than mental health awareness, especially in the setting of the current COVID pandemic. And all one has to do is turn on the news to realize that COVID is not only having a huge impact on our physical health, but on our mental health as well. So let's take a minute to define mental health. The Department of Health and Human Services and all of its underlying agencies are consistent in their definition of mental health. And they define it as our emotional, psychological, and social well-being. It affects how we think, feel, and act. Mental illness, on the other hand, is a disease state that negatively affects our emotional, psychological, and social well-being. And therefore, it negatively affects how we think, feel, and act. So being in possession of good mental health allows us to handle stress, relate positively to others, make good choices, work productively, realize our full potentials, and make meaningful contributions to our communities, whereas mental illness impairs our ability to do these things. So we've defined mental health and we've defined mental illness, but really there's so much more to it than that. It's much more useful to think of mental health as existing on a spectrum. So we have health on the far left in the green, and we have illness on the far right in the red, and then we have stages in between. And it's a stepwise decline from healthy to reacting to injured to illness. As we move from the left to the right. And also, as we move from the left to the right, we have an increase in symptoms of anxiety and depression, or mental illness in general. We have an increase in impairment, and we have a decrease in functional ability. And it's important to remember that the spectrum is dynamic. That is to say that we can move through the different stages. We can move to the left and to the right. And as a clinician, it's helpful for me to remember that patients can really present anywhere on this spectrum of mental health. And regardless of where they present, there are things that we can do and talk about to try to push them in the direction of health and away from illness. So let's talk about what these things are. So the World Health Organization classifies determinants of mental health into three categories. There's individual attributes and behaviors, there are environmental factors, and then there are social and economic circumstances. So if we're going to start by talking about things, determinants that push us in the direction of illness, or towards the red here. So in other words, these are risk factors for mental illness. So on an individual level, our genetic makeup, for reasons we still don't fully understand, some of us are born with a genetic predisposition to developing mental illness. And along the same lines, if we're born into a family with a history of mental illness, we're more likely to develop it ourselves. And if we experience adverse life events, particularly in childhood, such as trauma or abuse, we're more likely to develop mental illness. Having a chronic disease or diseases puts us at higher risk. Using alcohol and/or drugs and lacking a social support network all put us at higher risk. Okay, so now if we take a step back and we look at the social and environmental determinants of poor mental health, we see that there are many. And so in this diagram, all of the determinants or risk factors are listed in the blue boxes, and the outcome, which is poor mental health, is in the middle in the red circle. So we're going to take a minute to just go through each one of these risk factors and talk about whether COVID has had an impact on it. Okay, so unemployment. Unemployment is a risk factor for poor mental health. And we all know that COVID has caused an increase in unemployment on a societal level. NPR tells us that 26 million jobs have been lost in were lost in just 5 weeks. And ABC News tells us that unemployment rates are the worst since the Great Depression. And Willamette Week tells us that 250,000 Oregonians have lost their jobs due to COVID. So without a doubt, if we ask ourselves, has COVID increased unemployment? Yes, absolutely. Poverty is a risk factor for poor mental health, and it makes sense that if we have increased levels of unemployment, we're going to have increased levels of poverty. And indeed, the Washington Post tells us that tens of millions of Americans are at risk for falling below the poverty line. So has COVID worsened poverty? Yes. Housing insecurity, again, it makes sense that if we have increased levels of unemployment and poverty, we're going to have increased housing insecurity. And ABC News tells us of mass evictions on the horizon and a worsening of our overall housing crisis. So has COVID worsened our housing insecurity? Yes. Food insecurity. So we all remember, I'm sure, the panic buying and shortages that existed just a few weeks ago at the beginning of the pandemic. But there is concern that there may be ongoing shortages. And again, it seems as though the poor are especially affected by this, as food banks can struggle to keep up with demands. So has COVID worsened our food insecurity? Yes, for sure. Lack of community resources. So living in a community without the infrastructure or resources, um, uh, without good infrastructure or resources, I should say, is a risk factor for poor mental health. So in this situation, it may not be so much that these resources don't exist, but that COVID is negatively impacting our ability to access them. So I'm sure we've all seen these signs at our local parks and recreational facilities. And as the mother of three, I'm not quite sure how we're going to get through the summer without access to a pool. Personally, I foresee this as being a huge risk factor for my own personal mental health this summer, but time will tell. So if we ask ourselves, has COVID diminished our access to community resources? The answer is yes. Okay, poor access to education is a risk factor for poor mental health. Again, the parents amongst us are probably acutely and painfully aware that schools are closed, and not only are they closed now, but it's not entirely clear as to when they will reopen. And school closure is an issue that not only affects school-aged children, but college students and students at more advanced levels of education as well. So has COVID impaired our access to education? Yes, for sure. And then poor access to healthcare. So in this situation, COVID has really given us a 1-2 punch because in the immediate setting, many doctors' offices and medical facilities have had to close their doors because of the social distancing restrictions and stay-at-home orders that have been in effect, Tualatin Internal Medicine included. And so certainly in the immediate setting, patients have had less access to healthcare, at least in-person healthcare. Many of us have switched to a telemedicine platform. But when we look ahead, we know that some of these medical practices and maybe even hospitals will not be able to survive financially through this COVID storm. So even after the restrictions are lifted, there will likely be less healthcare practices and facilities for patients to access. So has and will COVID worsen our access to healthcare? Yes. Disease burden or presence, this one's a no-brainer. You can just ask the 1.5 million people who've contracted it, or the families of the 100,000 people who have lost their lives to it, to know that indeed COVID has increased the disease presence and burden society-wide. Social isolation is a risk factor for poor mental health. And so obviously social distancing practices and stay-at-home orders, while important and necessary, have had a detrimental effect, have increased feelings of loneliness and isolation. And even though, we've been alone together, many of us have been pretty alone. And so has COVID increased isolation? Yes. And then the last one, stress. Stress is defined as a feeling of emotional or physical tension, and it can come from any event or thought that makes you feel frustrated, angry, or nervous. And so we don't even need to turn to the news for this. Has COVID made us feel frustrated? Yes. Angry? Yes. Nervous? Yes. Has COVID increased our stress? Yes. Okay, so if we go back to our diagram, we see that COVID has negatively impacted every single one of the social and environmental determinants of mental health. So it's really no surprise that our mental health on an individual and societal level has suffered. Okay, so that was super, super depressing, and I apologize for that. But all is not lost. There is hope on the horizon. And there are definitely things that we can do to boost our mental health and push us in the direction of health. So we're going to take a look at some of those now. So the National Institute of Mental Health and many other organizations have released guidelines with coping strategies on how to boost one's mental health, particularly during COVID. So we'll go through these one by one. All right, the first one, take a break from the news. So during this talk alone, I've subjected you all to no less than 24 headlines with very disturbing, terrible news in them. And we know that repeatedly hearing about disturbing news and seeing disturbing images takes a toll on our mental health. So this is not to say stick your head in the ground and become blissfully, ignorant to what's going on around us, but rather it's a suggestion to be mindful and purposeful about the time that you spend taking in the news. So, it's suggested that we try to fill our days with pleasurable and productive activities and then designate specific times for news check-ins. Number 2 is take care of your body, and there's 4 components to this: exercise, eat healthy, get enough sleep, avoid and or limit alcohol and or drugs. So we'll go through these. So exercise, we know aerobic exercise can boost our mood. Exercise causes a release of endorphins in the body, and endorphins relieve stress and make us feel calm. And indeed, we have studies that show physical activity may lessen symptoms of depression and anxiety. This is a really great website. It's health.gov, and I like to go through this with my patients in clinic. It's put out by the Department of Health and Human Services. I find the 2 tabs on the bottom left to be very helpful: food and nutrition, and then physical activity. So if you click on physical activity, it takes us to physical activity guidelines for Americans. This is, again, put out by the Department of Health and Human Services. And essentially what they're telling us is to sit less and move more. But they give us specifics as to the quantity and quality of the exercise we should be doing. So in terms of aerobic exercise, if we're doing moderate intensity aerobic exercise, we should have a goal of 2.5 to 5 hours a week. And if we're doing vigorous intensity exercise, we should shoot for 1.25 hours to 1.5 hours a week. And so a lot of patients will ask me, oh, well, what do you mean by moderate, and what do you mean by vigorous? And so there's a reference list provided with different examples of moderate and vigorous intensity exercise. So for example, walking, even if briskly, is a moderate intensity activity, but jogging or running would be vigorous. And likewise, if you have access to a pool, recreational swimming would be moderate, but swimming laps would be vigorous. So essentially, you can choose which activity you prefer or you're able to perform physically, and then try to hit these guidelines. And again, for moderate, it's 2.5 to 5 hours a week, and for vigorous, it's 1.25 to 1.5 hours a week. But we should remember that these are not, we shouldn't try to limit ourselves necessarily to these amounts. The authors point out that the more exercise, the better for the most part, but that these are the bare minimums that we should be aiming for. And then in addition to aerobic exercise, we should be doing muscle strengthening activities. We should hit all of our major muscle groups, and we should do this at least 2 times a week. Older adults, those of us over the age of 65, we should also incorporate balance training in our regimens. So things like, Tai Chi or yoga, or something of that nature. Okay, so that was physical activity. Now, if we hit on the food and nutrition tab, we find our way to dietary guidelines for Americans put out by the government, again, every 5 years. And there's a lot of information here. And honestly, usually what I tell my patients is they need to know 3 things. They need to know what to eat, what not to eat, and how much to eat. So we all know fruits and vegetables are good for us. We should be eating those. And then in terms of grains, we want to focus on whole grains. Our dairy should be fat-free or low-fat, and our proteins should be lean or low-fat. So chicken breast, seafood, and then beans and peas, nuts, seeds, and soy are all good sources of lean protein. So that's what to eat. This is what not to eat. So we should really try to limit these things in our diet. So added sugars, sodium, and saturated fats. Added sugars should constitute less than 10% of our daily caloric intake. So the average American takes in about 2,000 calories a day. So 200 calories of those, or no more, and preferably less than 200 calories, should come from added sugars. And that translates to about 50 grams of sugar, which is really not that much, 50 grams of added sugar. Sodium, we should be taking in less than 2,300 milligrams daily, and that translates to about a teaspoon of table salt. And then saturated fats, again, less than 10% of our daily caloric intake should come from saturated fats. And as a reminder, saturated fats are usually things that come from animal products, so like butter, cheese, whole milk, all the delicious things, fatty meats like ribs, sausage, poultry, skin, but then also coconut and palm oil. Unsaturated fats are things like olive oil, canola oil, and the fats found in seafood, avocados, and nuts. Okay, so we talked about what to eat, we talked about what not to eat, and now let's talk about how much to eat. So this diagram helps us understand portion size and represents what we should be eating at every meal. And as you can see, it's essentially cut into quarters, so a little bit less than a quarter of lean protein, a little bit more than a quarter of whole grains, a little bit less than a quarter of fruits, a quarter about of vegetables, and then a serving of low-fat or non-fat dairy. Okay, so moving right along, we also know that sleep is important for mental health, and the CDC reminds us that as adults, we should be trying to get at least 7 hours of sleep a night, if not more. And then the CDC provides us with guidelines on maintaining good sleep habits, or sleep hygiene, as it's called. So we should try to be consistent. We should try to go to bed at the same time every night and get up at the same time every morning. We should try to make our bedrooms quiet, dark, and relaxing. We should remove electronic devices such as TVs, computers, and smartphones from our bedrooms. We should avoid large meals, caffeine, and alcohol before bedtime. And then they remind us that if we get some exercise during the day, then we have a greater chance of sleeping easily and well at night. And then for alcohol, the CDC tells us that there really is no safe amount of alcohol, that all alcohol consumption comes with risk. But if we are going to drink, we should try to limit our consumption to 1 drink a day for women and 2 drinks a day for men. And then the CDC does not endorse illicit or recreational drug use of any kind. Okay. So back to our coping strategies, we've talked about turning off the news and taking care of our bodies. And then number 3 is setting goals and priorities. And so essentially what they're saying here is that we should try to not let our days just kind of deteriorate into structureless chaos, basically. That we should try to set a daily schedule and make realistic goals, all the while keeping in mind that these are difficult times and things might not go exactly as we may hope or like. And so if we experience setbacks, we should not be discouraged, but rather pick ourselves up and try again tomorrow. And when we're making our schedules, we should be sure to include some time to unwind with relaxing activities. And these are some examples of relaxing activities: listening to music, soaking in a tub, reading a book. Coloring books for adults have become popular. You may want to learn how to massage your spouse the right way, whatever that means. Meditation, crossword puzzles, and then the guy on the bottom right is doing deep breathing. All right, and then connect with others. So we should be reaching out to friends and family in order to combat the feelings of isolation and loneliness that we've been talking about, both in ourselves and in others. And thankfully, we live in an age of technology, so we have the telephone, email, text messages, video chat, social media. But I'm sure I speak for all Tualatin Chamber of Commerce members when I say that there's nothing I love more than receiving a physical card in the mail, especially when it's from Send Out Cards, owned and operated by the Chamber's own Marcia Solberg. And Marcia, I will be expecting a card in the mail. Okay, moving right along. The last thing is focus on the facts. And this is about stopping the spread of rumors and misinformation as is consistent with the facts, not fear movement. Okay, so we've talked about things that push us towards mental illness, and we've talked about things that push us towards health. But sometimes, unfortunately, despite our best efforts, the forces that push us toward illness overpower our attempts at maintaining health, and mental illness ensues. And unfortunately, this happens a lot more frequently than we would like. Mental illness is common. More than 50% of US adults will be diagnosed with a mental illness at some point in their lifetime. And 1 in 5 Americans will experience a mental illness in any given year. There are many mental illnesses. This is not an exhaustive list, but for the purposes of this talk, we're going to focus on anxiety and depression. These are by far the most common and the most probably increased with the COVID pandemic. Okay, anxiety is characterized by excessive fears and or worries to the extent that they interfere with daily activities. It's the most common mental illness in the United States. It affects 40 million adults, which is 18.1% of the population. And even though it's highly treatable, only about 37% of patients with anxiety receive treatment. So let's talk for a minute about anxiety symptoms. So if a patient presents to clinic with symptoms concerning for anxiety, we usually ask them to fill out a form like this. And this is called the Generalized Anxiety Disorder Scale. There are 7 questions, so it's the GAD-7. And essentially this form asks if patients are experiencing any of these symptoms, and then if they are, to indicate how frequently they are experiencing the symptoms. So let's go through the symptoms. So feeling nervous, anxious, or on edge, not being able to stop or control worrying, worrying too much about different things, trouble relaxing, being so restless that it's hard to sit still, becoming easily annoyed or irritable, feeling afraid as if something awful might happen. So again, it's not have you ever experienced these symptoms, but in the last 2 weeks, how often have you experienced them? So not at all, several days, over half the days, or nearly every day. And so we ask patients to fill out this form, and then we tally up their score, and then that gives us an indication as to the severity of their anxiety. And then we can use this information to determine an appropriate treatment plan. Let's switch gears to depression for a minute. So depression is characterized by persistent feelings of sadness and or loss of interests to the extent that they interfere with daily activities. 16.1 million US adults, or 6.7% of the population, experienced at least one major depressive episode in the last year. And 20% of people will experience a depressive episode over the course of their lifetimes. And women are affected twice as much as men. So again, we have a form for depression screening as well, and this is called the Patient Health Questionnaire. There are 9 questions, PHQ-9. And again, we ask patients if they're experiencing any of these symptoms and then to indicate how frequently they're experiencing them. So the symptoms are little interest in or pleasure in doing things, feeling down, depressed, or hopeless, trouble falling or staying asleep or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about yourself or that you are a failure or have let yourself or your family down, trouble concentrating on things such as reading the newspaper or watching television, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety and restless that you have been moving around a lot more than usual, or thoughts that you would be better off dead or of hurting yourself. So again, it's not have you ever experienced these, it's in the last 2 weeks, how frequently, not at all, several days, more than half the days, nearly every day. Then we tally up the score, and that again gives us an indication as to the severity of the depression. So once we've made the diagnosis of anxiety and or depression, and I should note that it's very common for these illnesses to coexist simultaneously. So it's very common for someone with depression to have anxiety and vice versa. And for the most part, the treatment options are the same. So we have 3 options. We can do psychotherapy, we can do medication, or we could do a combination of psychotherapy and medication. And studies have shown that all 3 of these options are pretty much equally effective at improving symptoms, and that the choice of which option to take should really be based on patient preference. But traditionally, we've tended to use psychotherapy for more mild to moderate anxiety and depression, and then move into using medication, a combination for more moderate to severe forms. So there are a lot of different types of psychotherapy. Again, this is not an exhaustive list, but for anxiety and depression, the gold standard is really cognitive behavioral therapy. And CBT initially came out in the 1940s, and there have been several kind of reinventions or reincarnations of it over the years. These are referred to as waves. There's first wave, second wave, and most recently we have third wave CBT. And the third wave movement attempts to put more focus on mindfulness. And I mention this because I think people are probably likely to have heard of mindfulness-based stress reduction, mindfulness-based cognitive therapy, acceptance and commitment therapy. They've received a lot of attention lately, especially I feel like in this part of the country. And so it's good to know, it's important to know that these are good and effective options for anxiety and depression and fall within the cognitive behavioral therapy category. So very briefly, cognitive behavioral therapy has 2 components. There's the cognitive and then there's the behavioral. So in the cognitive part, therapists help patients identify and correct distorted, maladaptive beliefs and thoughts. And then in the behavioral part, therapists use exercises, education, and real life experiences to encourage behaviors that are more productive. So in layman's terms, you can think of it as CBT helps you view challenging situations more clearly and then respond to them in a more productive way. So for patients who decide to take the therapy route, usually the hardest part, honestly, is finding a therapist. And so what most of my patients do is contact their insurance companies to see which providers are in their network. But patients can also access the CDC website. They have a whole section devoted to helping people find and connect with healthcare practitioners. And then there are a lot of NGOs, I've listed some of them in the right, that specialize in mental health and provide similar services for helping people find therapists. A newer option is online therapy. So in this situation, patients are still working with a trained therapist and can still do therapy like CBT, but they're meeting exclusively online. There's no in-person contact. And so it's very easy to see how this could be very convenient for both patients and practitioners, especially during COVID. This is a picture of betterhelp.com, which seems to be one of the more popular online platforms, but there are many with good reviews, and I've listed some on the right. And then as a side note, I should also mention that many mental health practitioners who do traditional in-person care have transitioned to online telehealth platforms during the pandemic to provide patients with increased access to healthcare services. Okay, even more new are these therapy apps or mental health apps. And so in this case, the therapist has been removed completely from the situation, and patients are interfacing with the app directly. So these are guided therapy modalities and can be targeted toward anxiety or depression. There are some that specifically mention CBT. And we don't have a lot of information or data on how these compare to traditional therapies, but preliminary data suggests that they're better than nothing. That if you're in a place where you're deciding between doing nothing or you're not able to get traditional therapies, then the app is probably worthwhile. Okay, so we've talked about therapy, so moving on to medications. So there are essentially three main groups of medications that we use to treat anxiety and depression. There's selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and atypical antidepressants. And I've listed some common drug names. And essentially, all three of these classes of drugs work primarily by affecting serotonin levels in the body. And serotonin is a neurotransmitter, which is another way of saying it's a chemical messenger, used by nerve cells in the body to communicate with each other. And some people call serotonin the happy chemical or the well-being chemical because its presence in the body is associated with feelings of well-being and happiness. So this is a diagram demonstrating how serotonin reuptake inhibitors work. And I usually draw this out for my patients when we're talking about starting these medications, because I find that for the most part, when we understand how drugs are working, they suddenly become less scary and we become more comfortable and willing to give them a try. So in very simple terms, we're going to go through this diagram. So we have the green nerve cell, and we have the blue nerve cell. And the green nerve cell is trying to communicate with the blue nerve cell. And the way it does this is by releasing these little yellow balls, which represent serotonin, into the space between the two cells. And that space is called the synapse. And some of those little yellow balls connect with receptors on the blue cell, and then communication is achieved. And some of those little yellow balls get reabsorbed back into the green cell to be used for future communication. And it's reabsorbed through a serotonin channel, indicated in red. So then when we give medications, here it's an SSRI represented by this yellow oval. Basically what that medication does, it goes and it adheres to the channel and it blocks it. So the end result is that you end up having more serotonin in the nerve space or in the synapse. And basically that's it. That's all it does. So we're basically tricking the blue cell into thinking that there's more serotonin around. And as I mentioned, serotonin is the happy chemical. So we find that after about 4 to 6 weeks of taking these medications, 50 to 65% of people will see a 50% reduction in symptoms. Okay, so to summarize, These are very difficult times that we're all living through. We should all be focused on taking care of ourselves and our loved ones. We should try to remember and implement our coping strategies. But if we're still struggling, we should not hesitate to seek professional help. And with that, I'll close. This is the team. Thank you so much for listening, and I'll open it up for questions.